Hi, my name is Sarah Pine, and this is my video discussion board post for week number 5. This week, the post is talking about solution-focused brief therapy and narrative therapy. The first question that was asked was, how are these therapies similar and different? With both of these therapies, they are, like says in one of the titles, both very solution focused. There is a definite goal when using these therapies. One of the things as a counselor or therapist should know when using these therapies is how to comprehend the language that helps describe a client's individual's mental state. It's important to understand the client's environment and identity in order to guide the dialogue and give a client a degree of control over the outcome. Both theories are based on social constructs. Solution-based therapy is more often utilized in immediate problem-solving techniques. In contrast, narrative therapy empowers an individual to utilize their own chosen techniques for treatment. The next question asks, what are some strengths and limitations of each theory? With solution-focused brief therapy, the counselor and client may concentrate on finding solutions and speeding up the process of solving the issue. A restriction is if a counselor is unable to deal with the difficulties and components that are necessary to aid a client in the time allotted. So say there is an issue that is multifaceted and has many layers. This could present itself as an issue in the midst of the counseling. There's a lot of wiggle room in regards to narrative therapy, since the emphasis is on the individual's development, which allows both the counselor and to enjoy the process of figuring out how to move forward. The therapy's drawbacks is that it denies the client to modify themselves on their own. So it will always have to be in a line with their therapy sessions, and it will be kind of hard to do work outside of the office if it was not instructed by the counselor, because this could actually in turn mess up the process. The next question is, what are some ways that each theory is compatible and incompatible with a Christian concept? Solution-focused brief therapy is linked to God's disapproval of our sins. However, His love remains unwavering. It is incompatible with Christianity when it is all about mending problems instead of allowing people the time and space to find out what they want and how they want to change. In narrative therapy, clients are allowed to develop and repair problems on their own before a counselor tells them to do anything about their issue or condition, because it is the patient's approach. It is congruent with a Christian worldview. Errors may be easily made if the clients are in charge and supervising of their development. Without the counselor kind of as a moral compass in a Christian counseling setting, this could be very detrimental to the client. Like noted before, if a client starts doing something outside of the treatment plan, it could hurt the client and also not align up with a Christian worldview. The last question is, based on each theory's concepts and psychopathology, discuss any limitations as far as creating a measurable outcome for the clients. Solution-focused brief therapy doesn't offer the client sufficient time to work through solution-focused brief therapy can potentially not allot enough time for a client to work through underlying difficulties before they become apparent on the surface. Additionally, it is capable of ignoring